President of APSA International, Dr. Kushid Mitu Badula, Disease Control Officer of the World Health Organization, Mrs. Maki Oda, Consultant for the Embassy of Japan, Mr. Clyde Thomas, Vice President of APSA International, Mr. Patrick Meyepa, Secretary of APSA International, Mrs. Nirmala Jita, Director of Bioindustry and Project Development at the Economic Development Board, Mr. Darmen Bichu, Managing Director of Ducret Lenoir, Mr. Jean-Marie Richard, journalist of Radio 1, Platinum Partner of APSA International. We have Mr. Eric Chavois, who is Director of Eric Chavois Architects, Platinum Partner of APSA International. Mr. Tanya Lebar, Consultant, Partner of APSA International. Mr. Bharat, General Manager of Irvine Global. Dr. Armogam, Medical Officer and Clinic and Product Specialist of Irvine Global. Mr. Nunuk Chadi from the Finance Director of PROSEC, we welcome today. Mr. Alexandre Iladou, Director of Fundamental Builders. Dr. Damien Stesuk, Head of Medical Services of APSA International. Dr. Abbas Mahmoud, plastic surgeon in charge of wound care at APSA International. All the doctors, service providers, and staff. Dear members of the press. We are truly privileged to have such esteemed guests with us as we embark on this significant occasion. We will start a little presentation and display of all that has been provided through this grant to APSA International and of the works accomplished.
Yes.
Voilà. Thank you so much. And a big round of applause, please, for this. Now it is my great pleasure to introduce you to someone whose dedication and visionary leadership have shaped APSA into the esteemed organization it is today. Mrs. Audrey Hardy, the president of APSA, and since the early 90s, Mrs. Hardy has been at the forefront of developing a state-of-the-art organization to address the needs of patients suffering from diabetes. Her tireless work and passion have been the driving force behind APSA's evolution, and her impact on the lives of countless individuals is immeasurable. Please join me in warmly welcoming Mrs. Audrey Hardy.
Is it wonderful what they've done? I think we must just represent the seat for that. So we've got to do it protocol-wise. Huh? So, His Excellency, Mr. Kan Mashahiro, Ambassador of Japan to Mauritius, Dr. Mrs. Kursid Mitu Badula, Disease Control Officer, World Health Organization, Miss Maki Oda, hi Maki, Consultant, Embassy of Japan, Mrs. Nirmala Jita, Director Economic Development Board, Bioindustry and Project Development, welcome among us. All the platinum partners of APSA, distinguished guests from the private sector, esteemed doctors, service providers, members of staff of APSA, and obviously members of the press. Thank you all for being here. Good morning, and thank you for joining us today as we mark a significant milestone in diabetes care in Mauritius. I think we need just to give a big hand up. I count it both an honor and a privilege to be part of this launch and this project that will make a lasting difference in the lives of many Mauritians living with diabetes and related complications. This initiative is a result of a strong partnership between the Embassy of Japan, APSA International, and the government of Japan that has made this important step possible and which shows the commitment to improving healthcare much needed in Mauritius, in our country. APSA International has long been a leader in providing care for individuals suffering from diabetes and related complications, particularly in the area of foot care and, of course, diabetes management. Diabetic foot ulcers and amputations are some of the most devastating consequences of the poorly managed diabetes, unfortunately, which results in permanent disability, in decreased quality of life, and tragically, in some cases, premature death. But the good news is that these amputations are preventable with early intervention and detection. As we are looking at some 450 amputations each year in Mauritius, it's good to know that 85% of those could have been avoided. Through this project, worth at euros 57,741, but we did a good job. Huh? Have you seen all that we've done with this amount? Every cent has been used for this project. We are taking important steps to improve the quality of care of patients and reduce the risk of complications. Thanks to the generous support of the Embassy of Japan, the APSA Diabetes Care Center is now equipped, because of you, with a state-of-the-art ultrasound and 2 ABPI machines, which I'm told, because I'm not a doctor, are vital for early detection of cardiovascular issues and for monitoring blood flow, helping to prevent serious foot complications. This will empower our medical team to provide faster more precise diagnosis and personalized care plans. In addition, the new access road, which you all have seen, to the center and drop-off zone makes it now possible to individuals, especially those with mobility challenges, to enter our facility with greater ease and comfort without the added stress of navigating difficult access points like our entrance, which still needs to be taught to get a proper coat of asphalt on it, but it's happening, or being exposed to adverse weather conditions. In closing, I would like to express my deepest gratitude to the Embassy of Japan for their invaluable support and commitment to enhancing healthcare in Mauritius. I also wish to acknowledge the tireless and excellent work of the team at APSA. Their dedication to improving the lives of the many individuals, as much as 125 every day calling on us, with diabetes and food care needs, who call on us daily, has challenged and inspired us all. This partnership, which goes back to 209, repeated in 213, and now in 224, exemplifies the power of international collaboration, where resources and expertise are combined for the greater good of the community. I look forward to positive changes that this initiative will bring, and I'm confident that APSA's role as a center of excellence in diabetes management and food care will continue to grow, benefiting patients and their families across Mauritius for years to come, until the next project. Yes? Today, ladies and gentlemen, we are not just launching a project. We are opening a new chapter in diabetes care in Mauritius. Together, we are ensuring that more people receive timely, life-changing care, and preventable amputations and complications would become a thing of the past. I'm confident that this initiative will have a profound and lasting impact on the lives of patients and their families across Mauritius. May you join me for a huge, once again, a huge round of applause for the Japanese embassy, who has deserved and for being such a partner for healthcare, for improving healthcare, as I said earlier on, much needed in our country. Your Excellency, thank you so much from the depth of our hearts. Thank you.
Thank you, Mrs. Hardy, for your inspiring words and for sharing the incredible journey of APSA's development and as well the collaboration with the Embassy of Japan. As we continue to explore this important work of APSA and its impact, I'm now pleased to introduce you to our next speaker, Dr. Damien Sessuk, the Head of Medical Services at APSA. Dr. Sessuk has been a key figure in ensuring that APSA's medical services are at the foreground of patient care, particularly for those living with diabetes. Today, Dr. Sessuk will take us deeper into the DNA of APSA on how the organization operates as a platform where a multidisciplinary team of professionals work together to support and care for diabetic patients. This integrated approach is fundamental to APSA's success and its ability to provide comprehensive and efficient care. Please join me in welcoming Dr. Sessuk.
His Excellency Kan Masahiro, Ambassador of Japan to Mauritius, Damien des, Hajimemashite. Dr. Khurshid Mitu Badula, Disease Control Officer, World Health Organization. Ms. Maki Oda, where are you? Consultant Embassy of Japan to Mauritius, our partners, platinum partners, and our distinguished guests from private sectors, esteemed colleagues, doctors, and all the staff members of APSA. Thank you so much for joining us today. So as Ms. Maiti Shani said, I will tell you why it is so important for me and all my colleagues to have this multidisciplinary approach, because when you have a cyclone, as our president always says, when you have a cyclone, you just don't close your door. You also close the windows, you close everything. So it is useless to just have one side approach to diabetes, because as I said, diabetes is not a disease of sugar, it is a disease of heart and vascular problems. So wherever there are blood vessels, you can have a complication of diabetes. That's why you have eye complication, kidney complication, foot complication that we all know, but there is also the heart complication and all the complications around. So that's why in this means we want to actually increase our multidisciplinary approach and to check all the blood vessels. And one of the tools, obviously, is to go and look at the blood vessels. And that's what we can do now with this amazing machine, which is an ultrasound, which is non-invasive, doesn't hurt, it's not painful, and it doesn't cause any harm. We can check your blood vessels without any complications and see the blood flow. That will definitely help our surgeon, Dr. Abbas, who is here, to help the patient to improve their limbs and improve their vascular outcome on their limbs. We also have this ABPI, which is actually to check the blood pressure on your arms and your legs, because when you have a blood pressure, your blood pressure should be the same when you're lying down, should be the same on your arms and your legs. If there's a discordance between those two, there might be a problem in the tubes, which is in the blood vessels. So obviously, when you have a problem, we'll have to go and research on it. Because when there's a problem in the arteries, it's not just to give you a medication to improve it, but to see where the problem comes from and then to treat it specifically. So I won't give you all the details how we treat vascular problems, especially in front of our cardiologist, Dr. Baya. But that's what we do, and that's really the DNA of APSA, is also to prevent the disease, because it's not when the fire is on that you have to try to extinguish it, you have to prevent the fire to come, and that's why we want to have a more preventative approach. So as soon as there's the slightest beginning of problem, we want to assess the problem and then to prevent any complication of feet, of eyes, and of kidney. So for this, Mr. Ambassador, we are really thankful for your help and to provide an amazing tool for us to work the best we can. So again, arigatou gozaimasu, and we'll meet again.
Thank you, Dr. Sesuk, for that insightful overview of APSA's approach to patient care. Our next speaker, Dr. Abbas Mahmoud, is another key leader within APSA who plays a vital role in the well-being of our patients. In charge of APSA's wound care, Dr. Abbas ensures that our patients receive the highest standard of wound care treatment, which is an essential part of diabetes management. He also oversees a team of dedicated nurses and healthcare assistants who work tirelessly to support patients in their recovery. Today, Dr. Abbas will share with us the critical importance of proper wound care in diabetic treatment and the innovative approaches being implemented at APSA to enhance patients' outcomes. Please join me in welcoming Dr. Abbas.
Thank you, His Excellency, Mr. Ken Masahiro, Ambassador of Japan to Mauritius, Dr. Mrs. Khurshid Mitu Badula, DCO WHO, Mrs. Audrey Hardy, President of APSA International, Mrs. Maki Oka, Consultant Embassy of Japan to Mauritius, partners of APSA, distinguished guests, doctors, service providers, staff, and friends, and as well as members of the press. It is with great privilege that I address you all this morning to speak about the new equipment for the foot care clinic acquired by APSA International with the support of Japan. As you know, diabetes is a complex condition that can lead to numerous complications. Effective screening and diagnostic tools are essential for identifying early complications, which enables better management and improve health outcomes for diabetic patients. In 2024, with the full sponsorship from the State of Japan, APSA acquired two key pieces, which is here, two key pieces of equipment to assist for the screening and diagnosis of vascular complications in both diabetics but not only diabetics. These include these two ABPI machines, there, and a cardiac or a vascular ultrasound, which is next to it. Now, a fundamental principle in medicine, or even in engineering or troubleshooting, is look first, diagnose second, and then you treat. At APSA International, one of our primary missions is screening. Without screening, we cannot identify problems. And if we don't know, we cannot treat. Often by the time patients seek help, the complications are already advanced because they were unaware of their condition. The addition of these two ABPI machines from MESI has greatly improved the convenience and accuracy of vascular screening in our patients. ABPI, you heard it. Let me tell you, it's called ankle brachial pressure index. We measure, as Dr. Steshuk said, we measure the blood pressure at the ankle level and at the arm level. And we make the ratio, it should be 1. Same blood goes down, same blood goes up. Once we detect a ratio less than 0.6, we know that the patient is in critical situation. So we have to act. ABPI of greater than 1.3, 1.4 also will alarm our level for arterial blockage. Now, the early detection of the peripheral arterial disease will prevent serious complications like ulcers, infection, but most important is amputations. If any abnormalities is detected by this ABPI machine, then we proceed to further testing using our protocol to the ultrasound, which is here. This is one of the latest ultrasound on the market from Konica Minolta, Japan. And this state-of-art equipment has been generously provided by the state of Japan, and we are deeply grateful for this opportunity. The echo machine, which is usually used by our radiologists, but he also trained our general doctors to perform ultrasound examination, further enhancing our services to our patients. So not only radiologists, our GP also use this machine to diagnose and screen patients. So in summary, early detection and targeted interventions through vascular and cardiac ultrasound will significantly reduce cost of hospitalization, invasive procedures, and emergency treatments. By proactively managing the cardiac and the cardiovascular health of diabetic patients, we can achieve substantial cost savings for both the patient and our healthcare facility. Thank you, Japan. Thank you for your attention.
Thank you, Dr. Abbas, for that enlightening presentation on the importance of innovative equipment in wound care and diabetes management. It is now my pleasure to introduce our next speaker, Dr. Khurshid Mitu Badula, Disease Control Officer at the World Health Organization. Dr. Badula has played a pivotal role in advancing global health initiatives, particularly in addressing chronic diseases like diabetes, which continue to be a major public concern worldwide, in particular in Mauritius. We are truly honored to have you, Dr. Badula, with us. Please join me in welcoming Dr. Badula.
Thank you, Monsieur Shani. Your Excellency, Ambassador Kan Masahiro, Ambassador of Japan to Mauritius, Mrs. Audrey Audi, President APSA International, distinguished guests, ladies and gentlemen, good morning. First of all, please allow me to transmit the apologies of Dr. Anne Ansia, our WHO country representative, who unfortunately could not attend today due to commitments at WHO headquarters. We are here gathered for an event centered around the subject WHO holds at heart, diabetes. Diabetes is a global epidemic. Today, approximately 6% of the world's population, which is more than 500 million people, live with either type 1 or type 2 diabetes. This number has quadrupled since 1980 and is estimated to rise beyond 500 million by the end of the decade. Whereas premature mortality from other major non-communicable diseases is decreasing, early deaths from diabetes have actually increased by 5% since the year 2000. Mauritius has not been spared either. The latest NCD survey 2021 attests to it. We currently have 19.9% of adults living with diabetes. Nearly 1 in 2 adults is either overweight or obese, with its accompanying complications. These figures are projected to keep on rising unless the response to diabetes is further strengthened. Ladies and gentlemen, at the global level, these alarming numbers are driven by health system weaknesses in diagnosing, screening for, and treating diabetes, and in providing longer-term chronic care to people living with diabetes. In many countries, children, adolescents, and adults with type 1 diabetes struggle to access affordable medicines and technologies such as life-saving insulin, blood glucose meters, and test strips. Meanwhile, around half of all adults with type 2 diabetes are undiagnosed or unaware of their condition. This delayed access to care creates unnecessary risk of debilitating and irreversible complications such as limb amputations, eyesight loss, and premature death. To act on this urgent and growing epidemic of disease, death, and inadequate patient care, WHO has launched, amongst its initiatives, the Global Diabetes Compact. Bringing together partners, the Compact seeks to increase access to treatment and improve outcomes for diabetes, ensuring everyone can access comprehensive, affordable, and quality care in primary health settings. WHO also supports the prevention of type 2 diabetes associated with obesity, unhealthy diet, and physical inactivity. In doing so, we want to reduce premature mortality and complications from diabetes and slow the rapidly growing incidence of type 2 diabetes. The initiatives of the World Health Organization encompass uniting stakeholders, including people living with diabetes, around a common agenda, while integrating diabetes prevention and management in primary healthcare and universal coverage. Towards the people, we aim at improving health literacy and understanding of diabetes prevention and management while advocating for improved access to diabetes diagnostics, medicines, and health products. Positively, through WHO and its partners, solutions are available to help countries better prevent and control diabetes. From addressing the obesity epidemic throughout the life course, improving physical activity and modifying risk factors for type 2 diabetes, to ensuring access to essential diagnostics and medicines so that people are aware of their condition and can avoid complications by managing it well, we know what works. It is with utmost pleasure that we note how APSA, as one of our partners, translates these sets of recommendations into reality by bringing in the interdisciplinary care to the person living with diabetes, ensuring early detection and follow-up of complications while providing adequate psychological care. Not only this, but also by aiming to develop innovative solutions to encourage health-seeking behaviors of individuals at risk of developing diabetes, an endeavor WHO is dedicated to facilitate. It is indeed, ladies and gentlemen, through these initiatives and with the help of a broad coalition of partners that we seek to move from evidence to action. Let us not forget that behind every statistic there is a person, a mother, a father, a child, whose life is deeply affected by diabetes. Our mission is to ensure that these individuals not only survive but thrive. The World Health Organization commits to continuously work with partners such as APSA to build a world where diabetes no longer easily claims lives or limits potential. With this note, ladies and gentlemen, I thank you for your attention.
Thank you, Badula. Also to note that we have had a wonderful partnership in 2019-2020 to set up a branch. APSA Rivière Noire has has been created thanks to the collaboration with the WHO, and it's still running. We are now honored to welcome His Excellency Kan Masahiro, Ambassador of Japan to Mauritius, to address us with his words. His Excellency has been a steadfast supporter of initiatives that promote international collaboration and sustainable development, particularly in areas related to health and human security. Japan's commitment to improving global health, especially through programs like the Grant Assistance for Grassroots Human Security Project, GGP, has had a profound impact on communities worldwide. We are privileged to have His Excellency with us today, and we look forward to hearing his address, which will further illuminate the collaborative efforts that drive meaningful change in our region. Please join me in welcoming His Excellency.
Dr. Kushida Mitu Batola, Control Officer of the WHO, and Mrs. Audrey Hardy, President of the APSA International, members of the press, distinguished guests, ladies and gentlemen, good morning. It's a great honor to be with you today for this significant ceremony. I'm proud to hand over, on behalf of the government of Japan, one ultrasound machine, 2 ankle brachial pressure index, ABPI, and inaugurate the installation of a drop-off zone produced through a grant contact under the Grassroots Human Service Security Project, GGP, to the APSA International. Today, we have successfully worked together to accomplish this project in the view of combating diabetes, a disease that impacts millions of lives across the world, including Mauritius. The equipment symbolizes an important step in supporting those affected by diabetes. Early detection of diabetes and its complications is vital in combating it, which explains the purpose of these equipments. It's very encouraging to see that the APSA International is working enthusiastically to provide support to the communities in need. I sincerely hope that the Japanese assistance will contribute to your efforts by providing effective screening services and a safe environment, especially for those undergoing the foot care treatment, through the installation of the drop-off zone. Ladies and gentlemen, Japan remains committed to support Mauritius in achieving a better, safer, and healthier society. I'm confident that the equipment will go a long way in strengthening healthcare delivery for the general public. I congratulate the APSA International for being the recipient of the Grassroots Human Security Project, and I commend the fabulous work the organization is doing in improving many lives on a daily basis. As Ambassador of Japan to Mauritius, I will continue to strengthen our long-standing friendly ties and do my best to achieve it. Thank you very much.
So we are coming to this important and critical moment of the unveiling of the plaque. So we have now the distinct honor of inviting His Excellency Ambassador Kan Masahiro and Mrs. Audrey Hardy, President of APSA, to come forward for the unveiling of the plaque as well as the presentation of the medical equipment donated under the GGP project for the provision of medical equipment and improvement in accessibility of APSA Diabetes Care Center. 3.